So Joanne's she had a graduate student in the early 2000s who took her treatment and adapted it for kids. And so when I came on board on faculty, Joanne basically gave me the opportunity and said, you know, this was started by a graduate student. It was a small dissertation with just 4 kids. I'm a specialist in kid research. And so I took that treatment and created manuals and workbooks so that we could basically adapt it and apply it more broadly. So I had an OCAS study, OCAS grant from 2012 to 2016, and did a clinical trial. And now I have taken that, and we've analyzed the data, and now we're up and running again. And this time I'm collaborating with Dr. Tara Buck, who's a psychiatrist, child psychiatrist at OU School of Community Medicine. So this is a really nice collaboration between the 2 universities. And so we are recruiting at child psychiatry at the Schusterman campus and running our study out of Schusterman and out of Titan. Okay. And so the OU folks are helping with recruitment, finding patients, and then my graduate students are doing therapy and assessments.
Right, so that's the reason I chose TU and Dr. Cromer in particular, is because she is a woman of many expertise, and one being sports and giving me the opportunity to work with athletes, but also giving me the opportunity to work with kids, because I don't really know what I want to do yet, and I have an immense passion for working with kids, and I get to see them after they've gone through therapy and see them come in, sometimes almost like glowing, and that's because the therapy typically works, and we see a reduction in their nightmares. They're sleeping better, they're feeling better. In supervision, we will sometimes watch tapes from earlier assessments before they had gone through treatment, and it's amazing to see the shift just in like body language of these kids and adolescents when they come in and they're no longer having a nightmare every single night. It'll be maybe a nightmare once or twice a month, which is a huge, huge change. And sometimes they'll come in and they'll say, I used to have this really scary nightmare and now I'm not having it. And so we've gathered a lot of data, but at the same time, we've also seen with just these 14 kids and adolescents that the treatment seems to be working pretty well, and so we're pretty excited about where to go from here.